Either looking to see if a tissue is intact or if you can reproduce symptoms for a condition like biceps tendonitis. You're just looking to see if you can reproduce symptoms. But an infraspinatus test or a supraspinatus test, you're looking to see if that dude's intact, like if it's torn. So a torn rotator cuff, right? And that's where I'll address, when I talk rotator cuffs in just a couple weeks, really quickly, by the way, like not Monday, but the next Monday, we talk rotator cuffs. That's where I'll hit it again. So don't sweat it. If it seems kind of foreign, we got a few weeks to make it unforeign. I want to jump into the elbow. The elbow is really pretty simple. So you kind of take a look at the elbow and you go back and you go, okay, I got a medial epicondyle, a lateral epicondyle, right? And then the olecranon right here. All that kind of just makes sense. The ulna, that's the big hinging joint. The radius, it's not a hinging joint, but rather it's a rotational joint, right? That goes up. And then the whole concept of the radial-ulnar humeral joint making up the elbow. Now, most of the tests here really kind of apply to two things. Number one, your collateral ligaments, and number two, your flexors or your extensors of the wrist. That's it. So what we want to do first is we want to remember what these words mean. Valgus and varus. Valgus, the definition, we told you this the first semester of school. When the distal segment of a joint moves laterally. That is the definition of valgus, right? So, a valgus stress test takes and moves the distal segment of a joint laterally, right? So, I'm coming back over here to my model, and I'm going to take and I'm going to stress this by stressing the joint and applying the stress to the distal segment of that joint. Take a look. Now, here's a good thing. The knee and the elbow, they both got collateral ligaments. They also have very specific bones that go with them. So you could say the medial collateral, or you could say the ulnar collateral. And you're going to see it either way. Probably for testing purposes, they're going to say ulnar collateral ligament. Yes, sir?
I got a positive valgus stress test on a guy at my dojo. He fell through scaffolding and sprained his MCL.
Oh, really?
Yep.
You hinged that sucker.
I did. He was like, ah! And I was like, okay, you did that. It's real.
Yeah.
You really did.
I really need a kid that showed up at church a few weeks ago on crutches to come in and let me show you his knee. In fact, I'm trying to work it out. I am.
That'd be cool.
That dude's perfect. It's just, and then it has a big hinge on it as well. And that's kind of what you got to think of with valgus and varus, is they just hinge. You'll see that here in a minute. Now, that's the medial collateral ligament. So take a look, just in your mind's eye, look at my picture of the examiner and the tissue, and I'm placing stress right here. And what it's going to show is stress here, probably an arrow going this way and another arrow going this way as I'm torquing, and it's going to say what tissue is the examiner stressing. That's kind of the mode of what they do. So I'm pushing in, and if this is intact, it's going to lock in and keep that elbow from hinging, right? And you'll feel that here in a minute. Same thing with varus. Varus, the definition, when the distal segment of a joint moves medially, what tissue is protecting that from happening? That's the lateral collateral or the radial collateral. You might see it in either way. Just for some fun, there's also, and this is where they were complete jerks, there's also an ulnar collateral ligament in your thumb. right here. But it's a Varus or valgus stress test. Are you good on the stress test there? Let's talk about this one. Medial and lateral epicondylitis. Now, I'll talk arms or elbows here in a few weeks and we'll really explain this more. For today, let's just look at it this way. For the lateral epicondylitis, put your hand on your lateral epicondyle mass. And now, do me a favor. Flex and extend your wrist. What action occurs from the muscles at the lateral epicondyle?
Extension.
Wrist extension. All right, so hold that. Palpate that joint on the lateral aspect. And by the way, it's kind of more posterior too when you really look at it. All right, so there it tells us the answer to our question. To test for lateral epicondylitis, the examiner must ask the patient to actively extend the wrist. And I think if you look in your text, it will say the patient sitting, therapist stabilizes the elbow with one hand, the other hand on the dorsal aspect of the hand, patient's hand. Okay, so my hand is right here, right? And then what does it say? The patient is asked to extend, and this one says the third digit against resistance. Okay, so I'm here. Extend your third digit. That's not your third. There you go. Come on. Come on up. Up, 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 up. Right?
I can do it on my wrist.
Huh?
I can't do it on my wrist.
Oh, you can. You need to get back in the gym, man. What are you doing? Come on up. And listen, here's the deal. I don't know if you've ever had lateral epicondylitis. When you get in your fourth decade, it'll probably happen. Just kind of passing that out for you.
Is this tennis elbow?
This is tennis elbow.
Maybe
And it comes from the back end. I like to call it leaf blower's elbow.
that makes more sense.
I also will call it mountain biking elbow. I've got plenty of names for it. Because that dude right there hurts pretty much 5 days a week for me. Okay? And it's hurting right now when I touch it. On it. But again, if they extend and our hand, so just paint this out. The examiner is focused on the lateral elbow and asks for extension. It's a medial epicondylitis issue. Lateral epicondylitis, no, I'm sorry, I said that wrong. It's a lateral epicondylitis issue. Medial epicondylitis is the reverse. It would be the patient is flexing actively and the examiner is focused on that medial epicondyle, right? So those are pretty easy right there.
Are you supposed to feel something moving or something though? Like how do you?
Yeah. Well, you're going to feel some movement because the muscles are contracting. So yes, your focus though is pain. Your focus is pain. Did it reproduce their symptoms? This will make more sense too as we go along and you see what those two conditions really look like. And when you see those conditions in Therex, how we treat them. For example, one of the treatments for a lateral epicondylitis is a self-taught or self-applied, eccentric contraction, right? So that is here. Do you see what I'm doing? I'm eccentrically resisting the wrist extension. And some of you, it's like, man, that's tough. I'm not swallowing that one yet, Kendall. It's all right. Let's work on that. Right? There's my concentric contraction up of wrist extension. Here's my eccentric resistance. Man, my elbow's already feeling better. This is magic. I tell you what. And then there is a wrist extension stretch. That's sustaining. If you're not doing those two things and wearing a wrist immobilizer, you're not treating the condition anyways. And most of your cohorts who suck at upper extremity are going to be out there and they're going to be like, well, let's just do some concentric work. Yeah, make that condition worse. Let's see how that goes. You don't say a word. You just take that patient when they don't get better. You fix it. All right.
Hey, Kendall,
Yes.
can you do both of those real quick and get on video again? Just
Sure.
the two wrist
Come on.
ones.
Go ahead and stand up for me. I'm going to do these in standing. All right. So, first, what I'll do is for lateral epicondylitis, I'll put my hand at the back of the wrist and almost, I don't even really involve that third finger anymore. I used to when I first graduated because that's how the book said it. I'm telling you, my position now is I want to see here. And a lot of times I like to extend the elbow, right? But the book I think does say use 90 degrees. So here we go. Go ahead and come up, 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 right? That is for medial epicondylitis. Up. Medial epicondylitis. I'm sorry I said that. Sorry. You see my confusion. This is for lateral epicondylitis. Go up. Medial epicondylitis. Flexion.
And the two things you did right there at the end, the resisting, where you resisting.
That's a
the
treatment.
That's the treatment?
Yeah.
Can you show us that too?
Sure.
I think my dad has that, so.
All right. All right. So to treat lateral epicondylitis, we're going to start in an extended pose, and then we're going to eccentrically resist. So resist me, but let me win, right? And I just take you down, pass, neutral, up. Let's go faster. You're not resisting very well anymore. Right? And that's the thing is you will get faster. And that's a progression for eccentrics is to get faster. Start slow, get faster. Then let's stretch. And the way I stretch, you feel that stretch?
Mm-hmm.
Oh, isn't that good? Here, you do me.
Yeah, I love it.
Oh, yeah. That's nice. Okay. Oh, that's stretching. And really getting some internal rotation too, and pronation to really maximize, like really stretching that tissue. All right, so there's elbow. A couple that I want to do for wrist. And hand, both. But the two that I see the most here are Phelan's and Finkelstein's, and they both start with that F sound. So let's just do this real easy, right here. If you look at figure 4.5a, this is the Phelan's test. Now, the only way I remember this is I think about the word Phelan, and the only thing I can connect that to is, I'm sorry, you're probably not going to see my connection, but I'm going to tell you anyways, is the Sphinx. And how the Sphinx kind of sets like this. And if you don't really care about ancient Egypt, you're a nerd. You should get into it too. But the Sphinx kind of sets like this. And I go Sphinx, Phelan, 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 and I just put that together. Like that helped me. Now here's Phelan's test, right? Now take a look at what it says under Phelan's. The therapist flex wrist maximally and asks the patient to hold the position for 60 seconds. So it's a lot like Ruse. It's a timed test. So here's the thing. Timed tests usually look for a sensation loss. So it does just that, indicated by tingling in the thumb, index, middle finger. And take a look at what it says, maybe indicative for carpal tunnel. Now, let's just jump back for a minute. I know we haven't talked carpal tunnel a lot. I know Bill may have, maybe Jerry has. But here's the deal. The carpal tunnel, what nerve?
Median.
The median nerve. What ligament? Transverse carpal, right? And when you do this right here, what you do is you compress that poor old medial nerve. Median nerve. I said medial, didn't I? These masks, man. They mess with my beard, which messes with my tongue. Okay, so right there, that is Phelan's for carpal tunnel. The Finkelsteins, when you look up here for Finkelstein, here's what you can do. Take your dominant hand, hold it out, fold your thumb in. Everybody fold your thumb in. Grab your thumb with your fingers. Hold or deviate. Okay?
Harry Potter.
And what I do is I say Frankenstein was a hitchhiker. Frankenstein was a hitchhiker. And that's how I remember that one. It hurts a lot?
Yeah.
Well, you might have a tenosynovitis. Also known as something, I know Bill talked about it one time, known as de Quervain syndrome.
Mm-hmm.
Super tight.
That's what. Oh, that hurts.
I got the queer veins.
Oh, don't say that. Let's pretend you know.
That's what the queer veins.
Well, that might be a good deal. All right. I beat up the car enough. Who can come be my next model? Because I'm going to work on the leg now, for the hip, knee, and ankle. Now, I will confess, I have not done any recordings for upper extremity. I was actually hoping that Bill would participate a little bit with me on that. And it just got blew up in the spring last year, and I never got back to it. I do have on my YouTube channel all of the following special tests listed out: hip, knee, and ankle. So you can go ahead and get to that. But I'm not going to pretend like there's not better out there. There are tons of people who do way better, especially on the video side of actually making a quality video. Mine kind of suck. So if you want to find somebody else to explain it, fine. Whatever works for you, do it. But this one right here, when we start, these are the ones that I have probably seen more test questions crop up from. So think lower extremity.